with the election over, we're getting responses to it from various groups. And in response to Labour's election victory, health policy experts and NHS staff from national campaigning organisation Keep Our NHS Public will be sharing their thoughts and hopes on the new government. Dr John Puntis, Co-Chair of Keep Our NHS Public and retired consultant paediatrician, joins us now to share his thoughts on the news. Hello, Dr John Puntis.
Hello, June.
What is your first response to the change of government?
Well, many of us clearly looked forward to change, and we now have a promise of change. I mean, I think that slogan, or one-word slogan, was a bit overworked in the election campaign, and of course what it means in practice remains to be seen. But there's no doubt for many people that the NHS was either their number one issue or very high up on their list of issues needing to be tackled. So there are now very high expectations of Labour in terms of delivering improvements in the NHS fairly rapidly. And I think if we look at the manifesto commitments, those were extremely limited. And of course the issue of more funding has been put to one side. So I think now faced with the realities of a crisis in both health and social care and the reality of being now in the driving seat, I would hope for some more serious suggestions in terms of how we tackle the crisis.
Yeah, I agree. I think one thing that I found interesting was that West Streeting declared that there was an emergency rather than trying to paper over it as the previous government has been doing. At least the admission that things need to be done, that it is a crisis, is a start, I suppose.
Yes, I think the word he used was broken, that the NHS is broken. But my worry there is that the kind of language that was also used by Tories and others who are saying actually the NHS model is broken and outdated and we need to change the model. And I don't think that is correct. I think all evidence suggests that the founding model of the NHS is still very relevant and that it provided the best value for money in terms of how you provide services. So I'd be very worried if by broken West Streeting means we've got to change to a different model. I think that would be wrong.
I think so too, and I actually think that that's not what was meant, but it was unfortunate that term was used because I agree with you, it's been used as a criticism for quite a long time. I think perhaps what was meant was it's broken and we need to fix it.
Well, let's hope that's the case. Yeah. But one of the headline policies is to use alleged spare capacity in the private sector. Now, health analysts in the think tanks don't really see there being spare capacity in the private sector. They say any increase in activity in the private sector, taking staff away from the NHS, and actually less activity in the NHS. And this is more or less what happened last time Labour were in power, and they set up independent sector treatment centres, and those were going to bring additional capacity and work wonders. Who remembers those? I mean, there was a very damning assessment from the Commons Health Select Committee. They ended up costing more money, they undermined NHS services, and they added very little capacity. So why we're going back down that route again, I just don't know.
No, I suppose so, yeah. So if that's not the way forward, in your view, and given that, they have to start somewhere and that, their red lines make money tight, where would you suggest that it would be a good start?
Well, various things I'd like to see happen. One would be to declare a national emergency in health and social care so that the full scale of the problem is recognised. And then I would like a reaffirmation that they support the founding principles of the NHS so that they don't want to depart from those. I think then we need to see a funding settlement for the staff. I'm glad that West Streeting is talking to the junior doctors tomorrow. I hope that means that there's a willingness to negotiate there and to solve that long-standing industrial action. But actually all NHS staff could do with a pay rise, and I think this is important in terms of staff retention. So although there are plans to recruit more staff over time, if people are leaving because of overwork and poor pay and working conditions, you've got to do something about retention. And I think sending a message to staff that they are valued and they are appreciated would be really important, and that should start with thinking about how you do get pay restoration back to 2008 levels.
Yeah, I think, that starting, but it is bad, isn't it? So, I mean, starting with retention, if you want to attract people, is obviously the way. It's got to look like a good place to be.
Absolutely, yeah.
Yeah. And then, is there anything structural that you think might actually be useful?
The problem is that they're hoping to transform things without putting more money in. Mm-hmm. And, we actually need capital investment to rebuild the crumbling hospitals, to build the surgical hubs if we want to get the waiting list down. And there's no getting away from that. And again, there have been some suggestions recently that the way to do that is a kind of return to PFI and bringing in public-private partnerships, getting private hospitals to build facilities as part of NHS hospitals. And I think this would be a very step. And what we need is what actually worked, again, during the last Labour government. So what actually worked was an overall increase in funding for the NHS and investment in staff so that staff numbers went up. And if we want to solve the NHS's long-term problems, there has to be that kind of long-term plan of investment in facilities and in staff.
Yeah, I could see PFI marching towards this conversation there. When you brought it up, yes, it was. I remember it well, actually. It wasn't great, was it?
No.
No, so yeah, it's an investment in people, first of all, I think, isn't it?
Yes, I mean, you can't do anything if you don't have staff, and there's around 120,000 vacancies. And, people, morale is not good. People are overworked, they're tired, they're really fed up with working conditions. And these things have to be addressed. And obviously pay is not the only thing there, but pay is an important thing. And it's just like funding. Funding isn't the only thing either, but, funding is really crucial. And if we look at how much comparable European countries spend per capita on health, then it's about 18% more than we do. It's a sizable amount. In terms of billions, that's 40 billion a year less than France or Germany each year. And we lag very far behind in capital spending on new hospitals, new equipment and what have you. And I think this is why just productivity doesn't really improve. When sums of money are put in, they're totally inadequate to solve the sort of basic problems in the NHS of outdated equipment, not having the right facilities, not having enough staff. And then Labour is going to have to face up to this, I think. And there's lots of economic arguments in terms of fiscal multipliers. You put money into health services and actually that boosts the economy. You give pay rises to staff, they go out and spend it in the economy, and it helps other businesses as well. It's not a black hole, and it shouldn't be that health and social care are seen in a negative light as a kind of drain on our resources. They should be seen positively for what they are. They're both to help people live better lives, healthier lives, and more fulfilled lives, and they're a positive benefit to society that's really important.
I think there's been some polling to suggest that people understand that, and that they are, willing to pay a little more for the services they want.
I think that the information from polls of one sort or another, do show that people actually want more money spent on the NHS. Some of them feel that does have to come from taxation rather than borrowing. But also the vast majority of the public doesn't want to see a change in the NHS model.
No.
And they want to have, the equitable system, which is providing treatment for everyone, irrespective of being able to pay for it, and funded out of general taxation, and also a system where healthcare is publicly provided and publicly accountable. I think the politicians have been out of step with the public in terms of what the public want of the NHS.